My name is Deeksha Vishwamitra. I'm a translational research scientist at J&J Innovative Medicine. And I work primarily in the multiple myeloma space, looking at various bispecific programs. I work mainly on the Talquetamab and Talquetamab bispecific programs within the company. And my day-to-day role is to essentially analyze biomarker data that's coming in from our ongoing clinical trials with the bispecifics and informing how, the patient's RP2D selection, mechanisms of response, resistance to the actual therapies. And that's essentially what I do. So this abstract is mainly focusing on some of the translational research work that we've done for patients who were treated with the talquetamab and daratumumab and pomalidomide combination, as well as the teclistamab, daratumumab, and pomalidomide combination. And so these patients achieved a very high overall response rate in the clinic. And so this analysis was doing a deeper dive into some of the immunomodulatory mechanisms that's behind the deep responses that are seen in these patients. And so with both of these regimens, we're seeing, very, very good immune trends. So what we've seen is talquetamab and daratumumab and pomalidomide are three immunomodulatory agents. So as we know, talquetamab is a first-in-class bispecific antibody, so is teclistamab. And each one of those compounds has its own unique immunomodulatory mechanism of action. And so what we're seeing with this triplet regimens are basically the three compounds are working together in a complementary fashion to elicit these immunological responses that's actually contributing to the long-term beneficial outcomes in these patients. And all of these patients are relapsed refractory multiple myeloma. The tal-Darapom combination was administered in patients with three or more prior lines of therapy, so a heavily pretreated population, whereas the Tec-Darapom was administered in patients with 1 to 3 prior lines of therapy, so those are less heavily pretreated. Nonetheless, we're seeing consistent immune trends with both of these triplet regimens that, essentially just demonstrates how these regimens are very versatile in treating patients across all lines of therapy, and, basically informs and provides support for the high overall response rates that are seen in the clinic. Especially with the tal-Darapom regimens, these are basically high acting regimens. And also with the tal-Darapom, many of these patients have seen prior bispecifics in the past. And, it's well known in the field that prior bispecific treated patients do represent a hard to treat population. And so the fact that these regimens are working in a population that's highly refractory to prior POM or prior bispecifics, these complementary mechanisms of action just show the robustness of these regimens to treat or retreat patients who've seen prior bispecifics. This is a great program. We're really, highly backing up for these triplet regimens. There was a complimentary clinical oral presentation as well that was given prior to my oral presentation at ASH for the Tec-Darapom combination. I think these are regimens that are well received, and yeah, we're continuing our translational research work to answer some of the remaining questions as well.